Hello everyone, my name is Bernard Moya from Pregnant and Mom. Welcome to Pregnancy Chronicles. This is where we share your journey through pregnancy, labor, delivery and baby care. So we celebrate the joys, the pains, the highs and lows of pregnancy and motherhood. Our mission as Pregnant and Mom is to create a vibrant online community of moms and moms-to-be coming together to share knowledge and experiences. And our vision is to educate, empower, and equip moms and moms-to-be with knowledge, skills, and resources to build better families and communities. Now, in this episode, we will look at gestational hypertension and see how it affects the date, the time, and the mode of delivery. With me, here is superstar mom, Elizabeth Njambi.
Hey everyone.
Welcome to the show.
Thank you.
Now, you're a mom of two.
Yes.
Both a boy and a girl.
Yes, gender balance.
Gender balance.
I'm beating you to the punch.
So let's start with the first pregnancy.
Yes.
And it's how you suffered gestational hypertension.
Yes.
At around what weight?
The blood pressure, now for those who may not know, gestational hypertension is when your blood pressure is a bit high or just high during pregnancy, tends to end after the baby is delivered, as far as I have understood the concept.
Let me give
you can give them the proper definition.
Well, gestational hypertension is a high blood pressure in pregnancy, which occurs in 3 out of 50 pregnancies. And it's different from chronic hypertension, which a normal woman has high blood pressure before she even gets pregnant. And it's also different from preeclampsia and eclampsia. So, your story. Back to you.
Back to me. Yeah. 3 out of 50. Wow, the statistics were not in my... I guess I was the 3. One of
the 3.
So, in my first pregnancy, I was diagnosed, is it? Yes, with gestational hypertension at around the end of the second trimester. Or the beginning of the third trimester. It's been a while. That was like 6 years ago. But at the end of the second trimester, beginning of the third trimester is when I was diagnosed. At the time, my blood pressure was shooting up. The symptoms I had, so that I visited the clinic, were my fingers were getting very swollen, especially in the morning when I woke up. My fingers were very swollen. My face was puffy and swollen, and so were my legs. And that's usually the first indicator that your blood pressure is high. So when I went to the clinic, they measured that and confirmed that. At the time, I didn't even know what it was. I've just learned this after going through it. Yeah. So they said it's blood pressure. They were observing it. In the first pregnancy, it got very bad that they had to medicate me until I got to full term, at which point now they deliver the baby.
Before you continue,
yes.
I'd like to take listeners through some of the other symptoms of gestational hypertension.
All right.
Which include headaches, a headache that doesn't go away. There's also swelling, which you mentioned, edema. There's a sudden weight gain. There's changes in the vision, such as blurred or double vision. There's also nausea and vomiting. I don't know if that counts.
That's very hard to tell when you're pregnant. I was even going to say the same about the weight gain. It's very hard to notice that when you're pregnant.
The other symptom is that there's pain in the upper right side of your belly, around your stomach. And then the final one is making small amounts of urine, which also may be due to a compressed bladder. So they did the measurements.
Yeah, my pressure was up. I just had the one symptom, which was swelling. At the time. I didn't have any of the others, but it varies per person anyway.
Yes.
So I went to the clinic, they measured, it was high. Then I consulted gynecologist, obstetrician gynecologist. Yes, I had a consult. They put me on blood pressure medication to manage it. And told me now there's nothing much I can do rather than manage the BP and wait until I'm full term, at which point we review and decide on delivery options. Yes.
So what did they decide?
Because in fact, before I even got to full term, my blood pressures continued shooting up even on medication. So they had to admit me at some point. Before I got to full term, at around 36, 37 weeks, I was admitted because of the blood pressure, so that they can monitor me, because they said it was fatal. They can't let me go while it's that high. They put me on stronger medication and observed me for, I think, a day or two, to make sure the stronger medication was regulating it. So once the blood pressure was regulated, I was given an appointment. That's the time they advised that now, because of the way the blood pressure is behaving, they can't allow me to carry the pregnancy longer than I need to. So they wait for me to get to full term and induce. Now, full term is considered at 38 weeks, you're considered to be full term. So as soon as I hit 38 weeks, they gave me an appointment actually. As soon as I go to 38 weeks, I go back to the hospital and induce.
Yeah. And the same happened to your second pregnancy?
Yes. Now, my second pregnancy, the blood pressure was not as high. This one I didn't have to be medicated, thankfully. And it wasn't as bad. The swelling in the first pregnancy was my face, my hands, and my legs, my feet. But in the second pregnancy was mostly with my hands and a bit on my face, not so much as the first. The blood pressure in my second pregnancy wasn't as high as the first one, so I wasn't medicated. But towards the end, it started now climbing.
Earlier on, you mentioned that in the first pregnancy, your face would swell up like a muffin. You would feel like a muffin.
I usually knew when I woke up first thing in the morning, I would know, like, if I'm swollen, I would know, because my face used to feel like a muffin. I'd feel so puffy and full. First thing when I woke up in the morning. In the second one, I didn't have that. In the second one, I would have to go to a mirror to see if my face is a bit puffy, but I wouldn't, because it wasn't that swollen. I wouldn't feel it. But with the first one, it's like I had eaten some baking powder. It was really swell up. Yeah, so that's how I used to know, okay, today it's a bit high. Yeah.
Now, healthcares say that they don't really know what exactly causes the condition, but there are factors that increase the risk. One of them being having high blood pressure before pregnancy or with a past pregnancy, which happened in your case.
Yeah.
There's also having kidney disease. There's also having diabetes. And if you get pregnant before you're 20 or after you're 40, that increases the factors. And then being pregnant with multiples, such as twins or triplets. And now to the final one, which being of African descent, increases your predisposition. You're more predisposed. Predisposed. Yeah.
With me, the second one, I was already predisposed. So even going for the antenatal clinics, they were already monitoring my BP from the beginning, because they knew with the first one, since I had the gestational hypertension, I was more likely to have it again. Yeah, but with the first one, I don't think any of those factors applied. Although they do say if you have hypertension in the family as well, the genetic bit, that could also
increase your factors.
Yeah, I think that could also increase your factors. I'm not sure how accurate that is, though.
So you've been talking to Elizabeth Njambi, mother of two, a boy and a girl.
Yes.
What are their names?
Kiran and Kara. Kiran is the boy, Kara is the girl.
And my name is Bernard Muhia from Pregnant and Mom, and thanks for listening.